My name is Tori. I'll be your student nurse today. Can I have your name and date of birth, please? Okay, hello, Miss Amy. How are you? Good. So I'm going to close the curtain and provide some privacy. Okay, perform hand hygiene, of course. So today I will be administering your medication administration, so you know, the orals and the inhaler and nasals and things like that, just so we can get you in tip-top shape. So I've checked the MAR several times, once before entering the patient's room, another time once I've gathered the supplies, and now I'll check for a third time as I'm going through. So can I ask if you have any allergies? No? Okay, great. So I'll go ahead and gather your supplies right here in front of you. And we need 10 milligrams of lisinopril by mouth daily. Okay. Put that right here for you. Toprol XL, 50 milligrams by mouth daily. Pepsid, 20 milligrams by mouth daily. And Coric, 12.5 milligrams by mouth daily. Alrighty, do you mind taking them all your medications at once, or would you prefer to take them one by one? You can take them all together. Great. Okay, before we get started, I'm going to make sure that you can swallow just fine. So if you will take a sip of water for me. Good. Alright, so I'll get you some more water and I have your medications. So if you will take those for me. And take a sip of water if you need. Swallow for me? Okay, great. Thank you. Okay, and now I'd just like to advise you that since you did take lisinopril just for say, that you want to be cautious when you are rising from a chair, just because this is a blood pressure medicine, so you don't want to get dizzy or feel like you might fall or anything when you rise from rising too quickly. So now we'll be administering albuterol for you, 2 puffs from your inhaler. So albuterol. And so just shake this up a couple times. Okay. And have you sit up for me and tilt your head back. And on the count of 3, I'm going to release the inhaler and have you take a big deep breath and hold it for 3 to 5 seconds. So on the count of 3. 1, 2, 3. Inhale, hold it. Another puff. Inhale, hold it. And I'm going to hold about 10 seconds and hold it. Alright, thank you. And this will be done 3 times a day. Next, we'll be administering ofloxacin 0.3% otic drops, 2 drops. Left ear twice a day. So let's check to see. Ofloxacin 0.3. This one is on top. Here we go, otic. So I'm going to have you lay down for me in the side lying position. I'll assist you with that if you'd like. Yes? Okay, great. Okay. Roll to your side. Okay. And I'm going to clean your ear just so we can make sure we don't have any extra residue on there. Alrighty. And so I'm gonna warm the solution up just so you can make sure, you know, that it doesn't irritate your ear canal. Alrighty, I'll take the cap off and place the cap on its side so that it can remain sterile. And yes, 2 drops to your left ear. So yes, this is correct. So we'll pull your pinna up and back, seeing as how you're an adult, and administer 2 drops to the ear canal, and I'm going to make sure that the dropper does not touch your ear. So 1, 2, okay. And I'm going to massage your tragus for you, just to get it in there and nicely absorbed. Okay, then I'm going to have you remain on your side for 5 to 10 minutes so we can make sure that it gets absorbed in there properly. And 5 to 10 minutes has passed. Great. Okay. And next we'll be administering the Duragesic patch, 25 mcgs an hour, topical every 72 hours. Yes. Okay, awesome. Alright. So, and for this procedure, I will be applying gloves. Keeping my eyes on the patient. Alrighty. So for this procedure, I'll check to make sure that you don't have an old patch on. And I see that you do, so I'll remove this one and discard this in a disposable waste bin. And I'll wipe it down with a towel to remove any residue. Okay. And now I will get ready to apply the new patch, but first I'm going to grab a piece of tape and label the name, my initials, the date and time, and we're going to open the patch. Okay, apply this all together, and we'll do the alternate side just so we can make sure that it gets evenly distributed. So put that on there, the patch. Okay, and we'll put the tape on there to hold it in place. And since this is a skinless part, it should be nicely absorbed in there so the hair won't be in the way of the absorption. So we'll cover that up. And I'm just going to tell you, make sure that you don't scratch or try to remove the patch in any way, because you want to make sure that it stays on so that you won't be in any pain. Irritation will occur. Okay, thank you. Alrighty, next we will be administering ofloxacin, ophthalmic. So I'm going to raise you again if you'd like. Sit up with me. And sit in high Fowler's position. Okay, thank you. Okay, so we need ofloxacin 0.3%, ophthalmic. Yes, okay, this is the correct one. And we will be doing 2 drops to both of your eyes 4 times a day. So, I'm going to go ahead and clean out your eyes just so we can remove any residue or crust that you may have built up. Alrighty. Okay, good. And I'll take the cap off and place it on the side so that it can remain sterile. And also be sure not to touch the eye or the conjunctival sac to maintain the sterilization. So I'm going to pull it down after cleaning from inner inner to outer. So I'm going to pull down and administer 2 drops of the Aflaxin ophthalmic eye drops. And I'm going to have you look up for me, Amy. Alrighty, thank you. Administer 2 drops. Look up, please. Alrighty. 1, 2. Okay. And if you will, please keep your eyes closed and just roll your eyeball around in there just so we can make sure that it gets evenly absorbed. Okay, and if there was any systemic problems, you would want to press down on the lacrimal for about 1 to 2 minutes just to help. Okay. And now I'll do your other eye. Let's just come on around here. Okay. So pull down so I can see your conjunctival sac. Look up for me, please. Alrighty. 1, 2. Thank you. And again, just close your eye for me and move your eyeball around there for even absorption. Thank you. Okay, and last we have the Flonase nasal spray. So, alright, so we will be administering 1 spray to each nostril twice a day. So, alright, Miss Amy, I'm going to have you blow your nose for me just so we can clear out any mucus you might have built up in there. 1, 2, 3. Okay, thank you. Okay, and would you like some help with this procedure? Yes? Okay. So if you will, if you can't hold your nostril, I'll start on your right side. So if you will, hold the left one. And so I'm going to have you take a deep breath and look up for me. Take a deep breath and 3. And when I inhale, or when I squeeze the pump, on a count of 3. 1. Okay. 1, 2, 3. Inhale. Big. Okay. And alright, I'll do the other side. Okay, and now I'm going to hold your other side and do this one. And I'm going to maintain sterility by not touching the internal ears. So if you will, inhale for me, big on 3. I'll administer 1 more spray. 1, 2, 3. Okay. Thank you. And if you don't mind, just try not to blow your nose or anything for about 5 minutes, just so we can make sure that everything gets back into your membranes, and so it gets evenly coated. Alright. And that looks like this completes about everything for your medical administration today. Do you need anything else I can get you? Are you good? No? Make sure the bed is in lowest position. Okay. And the call light button is right here, so if you need anything, please let me know. And I will go ahead and discard the dirty gloves. And be sure to sign off on everything since you took it properly. And be sure to document everything. Okay. Alrighty. Have a good day, Miss Amy. Let me know if you need anything. Bye. can cut the last part out, but you should ask her. I don't think she'll know. These things are so freaking complicated. Like,
I got it?
okay, we got it, but now we can't get it to stop. And luckily, it was obviously stopped like before 15 minutes, but it's like we can't get it to turn off. I don't want to turn it off and then lose the, you know, recording. But
Where's Seth when you need him? Yes. You're being so good. Alright.